No, I asked. No, there is somebody is unmute பண்ண சொல்லுங்க. Some noise is being heard.
I would request others to please mute the speakers. Hari, can you mute?
Yeah. I think you can also do that. I'll also try.
Thank you. Now, thanks, Dr. Ramesh, for asking me to say a few words about the Teachers' Day. So I thought I will talk about my teachers because I am well past 80. My teacher, most of my teachers are no more with me, but they have done a tremendous job, especially from Madras Medical College and Stanley Medical College, where they have brought in several hundreds of students with great knowledge, etc. So this is a reminiscence of the great teachers, a tribute. Now, I belong to 1955 batch. That is exactly about 61 years ago I joined the medical college, and there's a Red Fort where the anatomy is being taught. I had my general surgery training in the same medical college in 1963 and MCH Paediatric surgery in 1969. That means I have completed about 52 years of pediatric surgery. Now, this is the 50th year reunion we had in Chennai in 2005, where all of us have joined together. Many from abroad also come. And you can see here, the person that you see is Professor Amaresan, who was the chief of nephrology in Madras Medical College, well-known person. And this is Professor Ramananda Kamath, who was the editor for North Indian Clinics of Pediatrics. And he was one of those things. And of course, there's me. Now, the anatomy department, we had a great teacher by name M.M. Cooper. I'm not sure if Dr. Prasad is here. And then if you might know about him. He's an outstanding teacher of anatomy who could draw all diagrams with both hands. And first time the anatomy department was converted into Institute of Anatomy in 1962, and he became the first director. He was one of the most loved anatomy professors in those times. Now, rest of the things we were taught in the clinical side, both surgical, medical, and obstetrics. There were doyens in that, of which I have selected a few of them, because many of you will know that this is Professor Sanjeev, who is a person who started one of the charity hospitals in Chennai, which is still running, where Krishnamurthy Srinivas was also there. What's the name of the hospital? I forget about it.
VHS.
Yeah, that's right. And he was a founding director for that, an excellent person who has got a great ethics in profession. We talked about, so under him worked Professor K.V. Thiruvengram, who ultimately became the professor in Stanley Medical College, and he was also awarded Padma Shri, and he died only about a year ago in Chennai following a COVID infection. Now, Professor Ratnavel Subramaniam, who had completed 108 years in the August 4th of this year, he was one of the most sought after physicians, and he was a physician for CN and Nathural. And then he's a person who was specialized himself in tropical medicine, and he was an authority on amoebiasis in those days. And then his theory of how infection from the liver migrates into the lung, etc., was well known at that time. Under him worked two doyens in neurology. One is Professor Jagannathan, who is no more, Dr. Arjun Das, Professor Arjun Das, who is alive, and his son is also one of the leading neurologists in Chennai. Now, along with them, we had Dr. A.L. Annamalai, who was a great teacher, Krishnan Gutti, under whom Dr. N.K. Mani, who was a nephrologist attached to the Apollo Hospital board. He was a great disciplinarian and then knowledgeable person and an excellent teacher. And then there was a professor by name Parani, but more than Parani, under Dr. Parani, Professor T.K. Ganeshan, who was ultimately became the professor of medicine in Coimbatore Medical College Hospital. He's a great physician and who can make diagnosis of rare diseases and infectious diseases, etc. But unfortunately, he died due to certain complications. Now, apart from this, we had in the surgical side, A.S. Ramakrishnan, that is A.S. Ramakrishnan, under whom I worked, U. Mohan Rao, who had a clinic in Punamalli High Road, was a well-known surgeon at the time. His son-in-law is now doing a plastic surgery work in the same place. A. Venugopal, who started first the urology department in the Madras Medical College, was the son of A.L. Ramsamy Mudaliar, and then he used to look like Clark Gable in those times, a very nice looking person. And we had a K.G. Krishnasamy and Dr. Atmaram Rao. Now, apart from that, in the pediatrics department, we had two doyens. One is Professor Achar and Professor Balagopal Raju, who liked me a lot. And then when I shifted from the ICH to Coimbatore Medical College Hospital, he tried his best to get me back to Institute of Child Health, but somehow he couldn't. And I know him very well. And then he presided over our first Indian Association of Pediatric Surgeons meet in Coimbatore in 1983. He was the chairman for that. These were the doyens in those days, and they were the professors there. Apart from that, at the time, we had the development of surgical specialties. Professor B. Ramurthy was a neurosurgeon, well-known neurosurgeon throughout the world, and Dr. Sadasivam on his known. There is an auditorium in the Madras Medical College Hospital, and he was the first cardiac thoracic surgeon there. And of course, this is Professor A. Venugopal, who started the urology department. In those days, we had a Sunday admission day, and in the Sunday admission day, the Director of Medical Services was the chief of the unit, Sangam Lal, and Dr. Sangam Lal's unit, Professor M.S. Ramakrishnan, was his assistant, and subsequently, he became the third unit chief in the government hospital. And from there, MSR went to Canada, got himself trained in pediatric surgery, and came back to India. Now, in the neurology department was a great department in the institute. In Madras Medical College in those days. Professor Ramurthy, Dr. Arjun Das, who is internationally known neurologist, Dr. Kanaga, who had done a lot of research work, and this is Dr. Balasubramaniam, who had his clinic, surgical clinic, and an excellent surgeon. And then his son is now Chidambaram, who is also a pediatric neurosurgeon. There is Dr. Jagannathan, and lastly Kalyan Raman, who was a Johnson medalist, and a great teacher, etc. Now, and this team was so good, I joined there as a special training. That is, as a senior house surgeon in the department. I worked there tirelessly for about 6 months duration to find out whether I will get interested in neurosurgery because the department was so good. But ultimately, I found the morbidity and mortality was so high, I decided not to take neurosurgery. Now, this is a certificate that is being given by B. Ramurthy about 62 years ago about me saying that you can get admitted into any place as a postgraduate student, etc. My MS General Surgery training was under Professor A.S. Ramakrishnan. Professor A.S. Ramakrishnan was a person who was immaculately dressed, and then he was a VIP surgeon in those days, especially for hernias, where he did what is called the Willie Andrews technique. Those days there was no mesh, and he used to cut the external oblique and bring the upper portion of the external oblique to the inguinal ligament, and then the lower portion of the external oblique he will cover over the cord and close it inside. And then the internal oblique is not sutured to the inguinal ligament, but the whole of the transversalis fascia is reefed up, and then subsequently it is covered by the double layer of the external oblique. Then he had an excellent result in that. And then he will never allow us to use antibiotics in the postoperative period without his consent. Under him worked Dr. R. Venkateswamy, a meticulous surgeon who became an internationally known hand surgeon later. With these two people, we had an excellent training of the basics of general surgery, and we never forget about them. And then subsequently, I went to Tanjavur Medical College. The first posting after my general surgical training under A.S. Ramakrishnan is to Tanjavur Medical College, where I worked with Professor Rangabhashyam. Professor Rangabhashyam was about 3 years senior to me. But he came with his FRCS straight from abroad to Tanjavur as the unit chief. Then I was his assistant, qualified assistant at the time. He was a fearless surgeon who will experiment boldly in all surgeries. And then he gave independent hand for me to do all the surgeries, and then gave the courage to do any surgery by proper planning, etc. Not only that, subsequently here, he was a great help to me in many things. And when I started the Department of Pediatric Surgery in the Coimbatore Medical College Hospital, when we had a problem to get a bed to get the operation theater, which I was doing it at 1 o'clock in the afternoon, we had 4.
Sir, you are disconnected. I think you have to rejoin, sir.
ஃபோன் பண்ணி சொல்லணும் ரமேஷ் சார்.
சார் கேட்கும்னு நினைக்கிறேன் நான்.
சரி, இல்ல இருக்காரா?
Are you able to hear me?
Yes, sir. Yes, just screen share is gone. So you can screen share again and then start from the same place.
This slide. Hello, Ramesh, are you able to hear me?
Yes, sir, you're on. Yeah, we are able to see. Thank you.
Yeah. So he helped us to with Professor Narayanan. He talked, and then ultimately we got an order saying all the pediatric surgeons who are posted there must be given all the facilities to run the department properly. And what facilities you are given, please note it to me immediately. So from that day onwards, the department was able to do, progressed. We had all the beds were given, nearly 20 beds were given, and our theatre work, etc. was given. So I'm extremely grateful to both of them, both Dr. Rangabhashyam as well as Dr. B. Ramu. Now, simultaneously, when I was in Tanjavur, the Department of Pediatric Surgery started working in the ICS. Now, this is the photograph of from ward number 17 at GH. The Department of Pediatric Surgery was shifted to the Institute of Child Health. At that time, Professor Marikar was there. She was the Director of Medical Education. This is Professor MSR and then Professor Achar. This is Dr. Nagasamy, who was the first neonatologist at that time. Now, Institute of Child Health had a number of doyens of pediatricians who are great teachers at the time. Many of them is no more. You can see here that Dr. Balagopal Raju, Dr. Nagasamy, Mrs. Chacko, is De Costa, who was the sister at the time, with Dr. C.T. Samandam. This is the Dr. Ayyanadar and Dr. Parvati, Dr. Pushpa, Dr. Narmada, and various others are there. And of course, here you can see Dr. B. Santanakrishnan. So in this atmosphere, we were there getting training in pediatric surgery, and it was a great moment for us. Now, when I joined pediatric surgery in 1969, we had this group of people who worked with us in the pediatric surgery department. Dr. Appukutti was the top-class pediatric anesthetist in India at the time. And Professor MSR was the chief, with Dr. Balagopal Raju as the director. Every Tuesday, we used to have Professor M.V.K. Shetty's review of all the x-rays. I think even now, we are doing those things there. And with us, we had Dr. Dayalan, who did the MCH along with me, though he was about 4 years junior to me. I finished 4 years of service and joined, but he joined directly after MS. And Dr. Dicky Maman, who did his MCH, and Dr. Shantavadanam. So we, 4 of us were there. We were the junior postgraduates, and the senior postgraduates were Dr. Dicky Maman and Shantavadanam. This is Dr. Padma. She did her FRCS and MS, and she was general surgical side for quite some time, worked with doyens like U. Mohan Rao, and ultimately, I mean, she was like a headmistress in the place, correcting our case sheets and diagnosis, the proper method, and ultimately she migrated to the United States, where, of course, you can see she has transformed into a westernized woman, where basically she was a typical classical South Indian Brahmin lady. Now, this is Dr. T.K. Subramanian, who's endowed with phenomenal knowledge about pediatric surgery, was a classmate of Professor TDR, and then he taught us the basics of the pediatric surgery and also guided us in various surgical procedures. Now he is doing well. He is about 92 years of age. He is in the United States. And of course, this is me, and of course, you feel how you are. But a little later, that's about a year or a couple of years later, Professor Kesavan joined us from Madurai, and subsequently Dr. Prasad also joined the Institute of Child Health. Now, with the Professor, MSR was a great taskmaster. Not only he used to make rounds in the morning at 8 o'clock, he used to make rounds also in the evening at about 3:30 p.m. so that the people will not rush away in the afternoon to do some surgeries outside. He will finish the rounds for 5:30 p.m. Now, he taught us everything, but of this, the things that were very useful later when I went to Coimbatore, where such surgeries were not being done, were of course the cleft lip, where the Ralph Minot method of cleft lip. He was a master in that, especially on cutting the lip margin, the full thickness of the lip margin, how to cut, he taught us, and then afterwards suturing the muscle layer and the mucosa so that there is no dimple or elevation in the columella. So, and then how to do as you cut, and then suture method, that's the technique of Ralph Minot. And subsequently, I started doing it in Coimbatore Medical College Hospital till sometime later, the plastic surgeons also started doing, but still we are doing the cleft lip surgery. And I was also a part of Smile Train program. Now, apart from that, the most difficult thing that in Coimbatore Medical College Hospital, before 1975, not a single case of cleft palate was being done. Dr. M.S. Ramakrishnan taught us a particular technique by which that is called the island flap technique based on the greater palatine artery. And then the whole island of the flap is taken, and then you, after suturing the whole length of the defect, it is cut transversely at the level of the bony aspect of the palate, and then the whole the island is now put inside so that the mucosal side faces the oral cavity and the raw one faces this one. This gives an excellent pushback to this one so that the velopharyngeal incompetence is minimized and the speech is good. And now I have got people who are now 30 years and 40 years who got almost near normal phonation. Of course, except sometimes there is a certain amount of nasality. The need for the secondary surgical things are not there. Now, M.S. Ramakrishnan, the first one who was doing what Braca has done later and popularized one. He used to take the preputial graft, put it on the finger, remove all the fat, and then put it over the area after the cardi has been corrected for a second stage. Now, I have used this method for example, a child who had come with a hypospadias like that, a U-shaped incision is made, a skin flap is taken, and then like a Snodgrass, the central incision is made, and then it is made wide, and a graft is taken and filtered, and ultimately reconstruction has been done. And I have been doing it for quite some time with fairly good results. Of course, as like any other hypospadias, you get into problems somewhere or there. So Dr. M.S. Ramakrishnan was doing surgery for a leprosy for claw hand and hand deformity. He was basically very much interested in the plastic surgery, needless to say, because his wife is also a plastic surgeon. Now, with the M.S. Ramakrishnan and Dr. Dayalan, we have done certain work with the mongrel or street dogs in the government Madras Medical College animal lab, where the whole of the diaphragm is removed and subsequently it was replaced by a stainless steel mesh, conjeverum mesh, then nylon dowling, etc., which ultimately formed the basis of Professor M.S. Ramakrishnan's talk in Pandale oration in the ASL. Now, this is the one child by name Ravindra David who had a recurrence of diaphragmatic hernia, which we had operated. He put in a stainless steel mesh, and this child for every year was greeting us till I left Chennai in 1975. He was alive for about 5 years without any problem. Now, I had Dr. M.S. Ramakrishnan. Idea was to bring out a textbook, but unfortunately he died. And Dr. Priya took over, and myself and Dr. Dayalan and K.K. Verma edited the first textbook. And subsequently, now the Essentials in Pediatric Surgery, another same book in a different format is being now done by Dr. Priya with Dr. Kalidas from Brighton, and of course myself and Abraham Chirian, or I'm an associated editors for the book. Now, Professor Virarajan is very well known to me. From the time I joined the medical college, he was my examiner in the university MCH examination. Subsequently, he became a great friend and a mentor. And then he was the first person who started doing laparoscopic work in children in South India. And you can see he took part in 1996, where in PSG Hospital, where Pave conducted a laparoscopic workshop. Along with Auckland Tan, he also joined there. In Capscon, when he reached about 80 years of age in Coimbatore, when Sudipta was the president of TPPS, we honored him. And then he was immensely happy about it. And subsequently, we had several opportunities to meet together, etc. I had the opportunity to go to Madurai to learn the technique of perineal urethrostomy and removal of posterior valves because we didn't have cystoscope. I took this boy from Coimbatore to Madurai because he was born with a raised blood urea. Creatinine, in spite of drainage, underwent a bilateral cutaneous ureterostomy. At 1 year, when his creatinine and blood urea came to near normal, we had a perineal urethrostomy and excision of the posterior valves by Professor TDR did it. And of course, I assisted him. And then subsequently, I came to Coimbatore and did quite a few by that. I also used an oroscope. And then using an oroscope, we were able to coagulate the valves in those times till we got our cystoscope by a donation from Rotary Club because from government, we were not able to get it. And this boy is still alive. He's about 43 years now. He has got chronic renal failure. He is hypertensive and he's in dialysis for the past 3 years. He had a myocardial infarction and the CABG was done in JKNM hospital. He's married and has got a child. He's a bunion exporter and he's provided jersey with emblem of IAPS in the 2014 IAPS conference at Kochi. So Professor Virarajan also demonstrated the limited decortication for empyema. Then he was a stickler to the rules and then the meticulous technique and everything should be in order. Even in various conferences and meetings, if a person is not doing the work properly, he will coolly walk away from the situation. I mean, he was such a stickler to the rules and is a great loss to our fraternity. Now, Rajamani is also my teacher. I mean, in the sense, I learned the basics of laparoscopy from Rajamani. I assisted him almost most of the cases in about 20 years ago. From the time he started doing laparoscopic work in Kuppasaminadu Memorial Hospital, I used to assist him. I had an endo trainer in my house. I got myself trained. I learned the art of doing endo suturing. And then after some time, I did one case independently. There's a child in whom there was an undescended testis and the intra-abdominal location. A high ligation of the testicular artery was done. The ligation, I did the ligation on two aspects and then divided it. And ultimately, I was satisfied that I was able to do it and learn the technique. And from that day onwards, I did not experiment further and left the procedure to safer hands. Rajamani is a great teacher of laparoscopic work, and many people down south are doing an excellent laparoscopic work, even in municipal hospitals and toilet headquarters hospitals, only because of the training imparted by Rajamani. And of course, it was the whole program was perpetuated by Dr. Ramkumar, who got all the instruments and technical things, etc. So these two people are responsible for propagating laparoscopic surgery down south, and they are great teachers. Now, finally, you need a teacher for non-academic purpose. Now, we talked about all about teacher. For me, my teacher for a non-academic purpose is my wife. And then she is the one who takes care of all of the things so that I am at peace to do what I want to do. So this is my consultation room where I have the photograph there. You can see Professor Raju, who liked me a lot, and then who was instrumental in various things, and both in Coimbatore Medical College Hospital. He's continued to help from Chennai. Professor A.S. Ramakrishnan, who was a doyen in general surgery, is a great mentor, the principal, and of course, Professor M.S. Ramakrishnan, about whom we, and the year 1991, January, we, myself, Dr. Ramkumar Raghupati, we organized M.S. Ramakrishnan first oration when he was alive in Coimbatore, and Dr. K.K. Verma gave the oration. But unfortunately, the same year, in May, he died suddenly, and it is a great loss to our community. Thanks to these doyens for what we are today. Thank you, Dr. Ramesh, for giving me this opportunity to tell a few words about my mentors and my professors. Thank you.
Thank you very much, sir. If you can unshare your screen. Next, I'll ask Dr. Ravikuar Raghupati to say a few words about